Alright everybody, I brought you a first video on patellar tendonitis, and I wanted to bring you a second video on some more strategies and tips to deal with the jumper's knee as we know it. It's something that doesn't go away, and I guess the sooner we get to know that and get on treating it, the better. So I'll bring you guys a couple extra exercises and techniques you can do to combat, heal, and hopefully prevent patellar tendonitis or the jumper's knee. And if you haven't seen the first video, again, jumper's knee is a tenderness or a pain underneath the kneecap. The subpatellar region usually results in inflammation, swelling, and even just touch will aggravate it as well. Something as easy as just rubbing against your bed sheets can aggravate that. So I'll show you a couple exercises and we'll get on our way.
So I typically come to you at my floor here, and I'm going to do so again today. The first one is, and again, not everybody may have access to something like a foam roller here, but our foam roller is a really good method to help increase the amount of circulation within different aspects and areas of the body, okay? For this one, what we're going to do is we're going to concentrate on our IT bands, and our IT bands are located down the side of the leg, and it's really just a thick coarse membrane or a fiber that kind of runs from the hip down to the side of the knee. And what can happen over time is this will get really tight. Okay, you can just picture anything getting very tight attached into a joint is going to really pull and cause misalignments within the actual knee joint itself. And you know, it might not be a direct cause of your patellar tendonitis, but when there are imbalances within the knee caused by tightness within our IT band, it can then result in our patellar tendonitis. So I do use a foam roller. You can pick up a foam roller, you know, local sports stores. I got this from a specialty kinesiology store. This was a little more expensive, but you can get cheaper models of these as well. So what I'll do is I'll probably post below in the details down here a link to somewhere where you can purchase this offline. So feel free to check that out after the video is over. What you're going to want to do first and foremost is grab yourself a foam roller. Secondly, it's about the positioning, okay? And I'm going to try to give you some looks at different angles here so you can see what I'm doing. But bottom line is we want to start first at the origin of our IT band, the insertion point of the IT band, and then through the belly of it, or through the middle aspect of it as well. So we're going to place our foam roller on the ground here, okay? And I'll give you a different look.
The idea here is you want to start up with the origin of the actual IT band, which is up around the hip. You'll notice here that we're just doing very small rolling motions upwards of the hip and the upper glutes. And all you want to do focus on here is just kind of warming the area up. We don't want to start right in the belly of the IT band. It's going to be extremely painful. You're going to notice that you do feel a bit of pain if you have tight IT bands. I kind of describe it as it hurts so good. Down here to the insertion point, so the outside of the knee. And then what we're going to do is we're going to do a full swipe, and we're going to take it down the entire length. And this is where you're going to feel a bit of discomfort, but bottom line is here you can control the amount of pressure you're putting down. Notice how I'm using my other leg and hands as a balancing point. Give you a look from that angle. And again, we're just swiping it down the entire length of the IT band. You can stack the legs. If you do this quite often and they're a little bit looser, this is going to give you a little more control with the pressure and maybe intensify the efforts a little bit more. Make sure you do both sides, but I'm showing you.
All right, the second part of this video is going to deal with what's called manual traction or manual sliding of our kneecap to stretch out what's called the retinaculum within the knee. And I'll spell that underneath, retinaculum. Don't be alarmed by this one. Obviously, it's going to appear to be a little bit invasive, pushing on our kneecaps. You're not going to dislodge the kneecap by any means. What we're stretching is what's really holding onto this kneecap and keeping it working really well. You're going to take your fingers. We're going to press on the kneecap. I'll give you a closer look here.
With a fair amount of pressure, you kind of want to push across on the kneecap itself. And you'll feel it slide, and you'll notice that a small lump will form, and that's normal. Just give it a little push. And back.
Okay, so you should, as you press, kind of see a little bit of a lump form or so. That's not a deformity. That's just the kneecap moving over. That's just the stretching of the retinaculum itself, and you're seeing some bony outcrop there. So try this one about 10 times or so. A 3 count, 2 or 3 count. 1, 2, 3, and back. and this is going to hopefully help increase circulation, blood flow through the knee, as well as just promote that healthy healing and recovery. So prevention is key. Obviously, if we can avoid ever having patellar tendonitis, then we'll probably won't be here, but watching this video. But it's important that if you're a coach or a trainer watching this video, the health of your athletes, the health of your client is imperative. And if you're able to bring stuff like this, tools like this to them, and help them recover from something like patellar tendonitis or IT band syndrome or something, you're going to be that much more effective as a trainer and have a larger population of clientele. So if you need anything, obviously you can get at me through the details below. I'll post my email address if anybody wants to contact me. I'll be happy to respond. I'll do my best. Obviously I get a lot of emails during the day. I'm also the owner of Project Vertical Jump Training System, as well as Fourth Quarter Fuel at-home conditioning. I'll post the links all down below so you can take a look at what I'm talking about. But I just wanted to bring you this free video, some more patellar tendonitis and healthy knee tips. Well, take care and see you soon.